Morning, everyone. Dr. Daniel here with Advance Upper Cervical. Thanks for tuning in to episode 13 of the Wellness Wednesday series. I'm ecstatic to be joined here today by my good friend, Dr. Carolyn Krieg, who is a DO who takes a functional medicine approach to her practice. Just a quick little background on Dr. Krieg. She was a Kaiser physician for several years, about 7 years or so, before wanting to take the next step in her practice with bringing really an integrative approach in. So she practices something that we call functional medicine. What is functional medicine?
Yeah, functional medicine is an approach. It is an approach. I didn't mean to sound like I said isn't. And it's a way of looking at wellness and chronic conditions, taking a holistic approach. So looking at the whole body, looking at root cause is the main buzzword that you hear. So instead of where in conventional medicine a lot of times we'll go in with an issue, a symptom even, the doctor tends to want to just prescribe a medicine to fix that particular symptom or condition, versus looking under the hood, figuring out why this thing is going on, and then taking it from there and doing more investigation, if you will. So
that's an approach that I can certainly get on board with. As a chiropractor, we're oftentimes looking for the root cause in a lot of spinal injuries and disease. Now, my understanding is that you really specialize in serving the female population, especially with hormonal balance and as it pertains to going through transitions, maybe like menopause.
Right.
There seems to be a trending topic that I've been hearing a lot about these days, estrogen dominance. Do you mind telling us what that is?
Absolutely, absolutely. I think we're seeing it more and more for various reasons. Estrogen dominance is something that we see, I would say, most frequently during the perimenopausal phase, which is the 5 to 10 years prior to reaching menopause. A lot of times this is in the 40s. When women are in their 40s. And one of the reasons it can develop is because as we approach menopause and our ovaries start to produce eggs less, our hormone levels start to decline and fluctuate. And one of the things that happens is progesterone can decline first or further before estrogen starts to decline, and it can create this imbalance. And there are other reasons for it. Some women just produce more estrogen. Some women don't clear estrogen as well. So even in our reproductive years, we can develop estrogen dominance if we aren't getting rid of estrogen for various reasons, whether it's our diet, lifestyle, genetics. Some of the symptoms of estrogen dominance that women will see: heavy periods, irregular periods, more severe PMS, anxiety, insomnia, but other things like fibrocystic breast disease or breast tenderness prior to their period. These can all be caused by having more estrogen around. Also fibroids, uterine fibroids. Endometriosis is another one. Another unfortunate thing is because of this more higher level relative to progesterone of estrogen, there can be an increased risk of certain cancers that are estrogen sensitive.
So I gotta ask, because these symptoms that you're listing off seem like they're becoming more and more prevalent in our communities today. Is there a particular reason for that? Is it simply a lack of diagnosis? Is there environmental factors? What's kind of a couple reasons why you would see this come up? And if someone's experiencing symptoms like this, what steps do they take?
Yeah, I would say, and I think we see this in all areas of medicine and health conditions. One of the big reasons it comes up more and more is because we all live in this very toxic environment. And as I mentioned earlier, estrogen, the way we clear or metabolize or get rid of estrogen from our body is through the liver, through our detoxification pathways. And by the time we reach our 40s, or a lot of times earlier than that, if we've had or been exposed to a very toxic environment and we aren't getting rid of our toxins well, then that can cause that buildup of estrogen. And so the more we work to help clear toxins from our body, then the the more balanced our hormones will become, the better we're clearing our estrogen, and the more we can get ourselves into a better state of hormone balance.
Sure.
So the things that I always recommend is when I have patients come to me and they are experiencing symptoms of estrogen dominance, one of the first things I'll frequently do is put them on a detox or a cleanse. And it's as simple as doing a 2-week clean eating, and then using there's a product that I will typically use that includes a supplement with herbal supplements and supplements that support the liver and the liver detox pathway, as well as a powdered supplement and the shakes that you take. So that's a really great thing, and a lot of times women doing this detox for 2 weeks can simply help some of those symptoms. The other thing then is to work on trying to get rid of toxins in your environment. For example, using glass and stainless for your water and for your food, not using plastic, trying to put use body products that are clean, that don't have a lot of toxins in them. So just being aware of those sorts of things, eating organic, eating grass-fed. So trying to do what we can to minimize the toxins that we're exposed to.
Okay.
And then also, finally, there's a lot of really good supplements out there, some targeted supplements that can help us clear our estrogen from our body. Things like DIM, which is something that is an extract that comes from cruciferous vegetables. Something called calcium D-glucarate, which is something that helps work in the colon to help get rid of estrogen. So I love working with women to give these recommendations and give them or recommend some of these great supplements. And
Sure.
I see dramatic results, and
Sure.
so it's really great.
And so for anyone watching, if you're maybe going through a transition or you feel as though there's a hormonal imbalance, obviously Dr. Krieg is a wealth of information, so feel free to reach out. I'll put the contact information in the link here. Thanks for coming on. And
You're welcome.
it's really interesting that the more we study different layers of health, how much it always comes back down to balance.
It does.
And so on that, thanks for joining us. And remember, is your head on straight? Thank you.